You're listening to ABC News.
77 WABC.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving to special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hello, good morning. I'm here with Ariel Lederman. How are you?
I'm good. How are you?
And we have our staff in ABC Studios taking your call. We're live. We're at 1-800-848-9222. So if you have questions, you're welcome to call us. How are you today?
I'm doing well. And yourself?
Lots of news today. We have lots
happened?
of news. We have lots of news. Well, I want to talk actually about a case that was brought to you this week. A friend of yours, mother, had a small breast cancer, right?
Yeah, small cancer.
And your friend was obviously very upset. It was her mother. She had to have a mastectomy, we were told, right?
That's what the surgeon said.
Yeah, the surgeon said he had to have a mastectomy. And the daughter said the same thing, right? She has to have a mastectomy, right?
Uh-huh.
And the daughter said she was given the words probably of the surgeon. She was telling us probably the words of the surgeon. She was acting as a siphon for the surgeon.
Well, the mother had a lumpectomy first.
Right.
And she was going to follow it up with a mastectomy.
But why?
I don't know why. Why would you go to the operating room twice?
Well, it's not only going to operating room twice. Why would you want deforming surgery? Is it because results are better or more convenient? Or are there some people out there that think if you do a mastectomy, you're going to get better results? Why is it?
I don't know. So,
well, I think we need to explore that today because so many women are getting mastectomies who do not need mastectomies. Now, when I was training, and I trained in Boston at Harvard, we were fighting, and women were fighting to save their breasts. And over that period of time...
That's natural.
Well, you'd think it's natural. I don't know what's natural. So over that period of time, there were many, many studies in the United States and overseas that randomly allocated women to choose lumpectomy and radiation, lumpectomy alone, or mastectomy. So lumpectomy means remove the lump of cancer. Mastectomy means remove the breast. And lumpectomy and radiation means do the lumpectomy, remove the little lump of cancer, and then radiate afterwards. Now, we explored in your friend's mother, and actually she had a very small cancer.
Yes.
Right? So she had a small cancer.
Localized.
They said that her weight was substantial, right?
It
so
was.
Probably she has a good-sized breast, and probably removing the breast is probably going to be pretty deforming, right?
I believe it will be.
Right. Well, hopefully we'll be able to provide her with some information so that she understands she'll have a worse result with mastectomy. And there's actually data this week in JAMA, which is the Journal of the American Medical Association.
Big journal, right?
Very famous journal. It's a very reputable journal. And it actually looked at this specific question, who does best, lumpectomy, radiation, or mastectomy treatment for women with breast cancer less than 4 centimeters in size?
So let's hear the results.
Well, okay. So, first of all, the study was reported this week, and it came out on the 24th, so that's pretty current news, right?
That's yesterday.
And it evaluated women with early-stage invasive cancer who underwent lumpectomy and radiation, or mastectomy alone, or mastectomy and radiation. And it used the SEER, S-E-E-R data. Do you know that the SEER, S-E-E-R
Yeah, it's a huge
data?
database.
It's a huge database. It comprises more than 25% of all Americans. Certain states, like Connecticut, is completely involved, and certain cities are completely involved, so it's involving millions of Americans. And it's a way to evaluate what happens with certain treatments.
It's a good database.
So, yeah, it's a pretty good database over many, many decades. So the study evaluated the assessment of 132,000 women with early-stage breast cancer. Early stage was less than 4 centimeters, so that's about 1.5 inches, with 3 lymph nodes or less, and they were identified from the SEER database. And they underwent either breast-conserving therapy, which means lumpectomy. 92,000 had lumpectomy. Mastectomy, 35,000, or mastectomy and radiation, 5,000. Okay? This is all from 2008, going back 10 years to 1998.
So
it's
three groups of women.
3 groups of women: mastectomy and radiation, or lumpectomy and radiation. 132,000 women in recent years. And they compared the women who got lumpectomy and radiation, mastectomy and radiation. Now, the women that got lumpectomy and radiation were more likely to be white, to have a smaller tumor, estrogen receptor positive. Okay. Women receiving mastectomy were younger at diagnosis, 52 years versus 57 years. And what happened? Okay. Who's living the longest? That's the issue, right? The critical issue. Who's living the longest?
Who lives longest?
Okay, so you're going to tell your friend, look, there's data out this week, and who lives the longest?
I'm guessing the 2 groups that got the radiation.
Okay, so the 5-year data for breast cancer-specific survival rates, that means free of dying from breast cancer in these groups. Okay, if you had lumpectomy and radiation, 97% 5-year cancer-free survival. 97%. That's the best results. If you had mastectomy alone, it was down to 94%, or mastectomy and radiation, 90%. Now, the 10-year results were even more impressive. 10-year results: lumpectomy and radiation, 94%, and the mastectomy group was 83%.
That's a huge difference.
Huge differences. And there was multivariate analysis, which showed the same thing. Multivariate analysis means they took into account the size of the tumor, the age, lymph node status.
Multiple things.
Multiple criteria. And the authors concluded, quote, patients who underwent lumpectomy and radiation have a higher breast cancer-specific survival rate, meaning more people are alive, than those treated with mastectomy alone or mastectomy and radiation for early-stage invasive ductal cancer. So here's the data. So why would anyone get a mastectomy when the data shows you can live longer if you have lumpectomy and radiation? Why?
It doesn't make sense to me.
It doesn't make sense. And so for your friend's mother and your friend, you've got data to show them. For all our listeners, if you have a breast tumor for less than 4 centimeters or 3 lymph nodes, certainly this study applies to you. And it can apply to you if you have different numbers also. This is just a group of patients that was convenient to study, 132,000 patients. So don't think that if you have mastectomy, if you have some arrangement with God that you're going to pray, I'll lose my breast to live. Actually, by losing your breast, according to the study, you're going to have a higher chance of the cancer coming back and dying. Higher chance. So there's no reason here to rush for mastectomy. We believe that women are more content by saving their breast, keeping the body intact, and have an equal, or in this study, better chance of being cancer-free. What more can you say?
That's what you want. You want to stay intact and not have cancer.
Stay intact, not have cancer, and be alive.
Yeah.
Yeah, be alive. So why would anyone do anything else?
I don't know.
Anyway, if you have comments, you're welcome to call us. We're at the WABC studios. We're live. We're just a few steps away from our office. By the way, why do we do this show? I usually give an introduction, which I skipped over today because I was so excited about this study. But my name is Dr. Gil Lederman. We have an office, private cancer treatment office, where we treat people with cancer personally. So you're not a number. You don't walk down a million steps in the corridor wondering who's who and what's what. We're at 1384 in Broadway. We're located just between Macy's and Times Square in Manhattan. We're easy to get to. Almost all the buses, trains, subways get to us. We're by Penn Station, Grand Central, Port Authority, PATH. So, in fact, today we're going to take the train out of town for a little trip, right? We're doing a road trip, you and I.
Yeah, it should be nice.
Yeah, it should be nice if the weather doesn't freeze up here. We believe that a private cancer center means when you come in, we know who you are, you know us, no miles of cold corridors, no strange faces, no locked doors, no wondering where to go. No, you come in. If you're Mr. Jones, we say, hello, Mr. Jones. And if you're Mrs. Smith, we say, hello, Mrs. Smith. We know you, you know us, you know our staff. We accept most insurances, Medicare, Medicaid. We answer our phones day or night. You can speak to the doctor, not a secretary. You can call us at our number, 212-CHOICES, during the day, during the night, if you wish. And you can speak directly to the triple board certified radiation doctor. It's not students, not interns, not secretaries. You get answers, not confusion.
Sounds good.
Hey, I'd like answers, not confusion.
Yeah,
right?
I want
that.
that.
To call, and you don't get all those machines that press 1, press 62, press 75.
Those give me a headache.
If you want to speak in blah, 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 you speak 165. No, a human being answers our phones.
Always.
Yeah, it's pretty good. Give us a shot. The best thing is make an appointment. The best thing is we sit down, we go over your records, and we make an appointment and figure out what's going on.
And you have the urgent care center.
We have the urgent cancer consultant. So we promise people that we'll see them within one business day. You call us at 212-CHOICES. People say, what number that? Well, you do 212-CHOICES because you can think of it and remember it easily. I can't remember numbers, but 212-CHOICES, if you have a paper and pencil, is 212-246-4237. 212-246-4237. But if you have a phone, you can punch out choices, because you do have choices. And as you'll see here today, that sometimes you need some new choices, because sometimes the old choices are pretty sad. Pretty sad. So you can call for an appointment. We're super convenient. We're by the trains, subways, buses. We're at 38th and Broadway. Someone asked me why in our commercials we don't say we're at 1384 Broadway. Well, we only have 60 seconds. So 38th and Broadway, you know exactly where it is. Most people in New York say, wow, I've been there. I've been over at Macy's or Times Square or
Herald Square.
Or Herald Square. I've been over there. I know where 38th and Broadway is. 1384, you may say, well, where's that intersection? I don't know.
38th and Broadway.
38th and Broadway, yeah, where is. So give yourself the most chances. Give yourself the most choices. You're welcome to call us at 212-CHOICES. We believe in data, and we believe in getting you what we believe is the best possible chance to live and hopefully keep your body intact and hopefully avoid surgery if you can. So that's our philosophy. My name is Dr. Lederman. We're going to go to a word from our sponsor, and then we'll be back with more information and more reasons why you should have choices. 212-CHOICES. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 2 and 2 choices for a fresh